Okay friends, in previous session we discussed about the different aspect or different features of this bone that is known as ulna. Okay. Now ulna having a trochlear notch, having a olecranon process. Let's talk about this olecranon process and attachment of the olecranon process. Look at the superior surface of the olecranon process. This is the margin. This is the margin, and at the margin there is an attachment of the capsular ligament of the elbow joint. The posterior rough area is there. This is the rough area. There is attachment of the tricep, tendon of the tricep, which is extending the elbow. In between this capsular ligament and the attachment of the tricep, there is a bursa. Three sequence: and margin, capsular ligament, in between bursa, and posteriorly attachment of the tricep is attachment on the superior surface of the olecranon process. Now coming toward the posterior process. Okay, look at this trigonal zone. Look at the trigonal zone of the olecranon process, which is smooth and nothing is attached here. This is subcutaneous. This is covered by bursa. And again, if that bursa get inflamed, that is known as student's elbow. Like this, if I putting my hand, my elbow on a hard object, I'm studying in such a way, the bursa get inflamed, as is known as student's elbow. And student's elbow is having other name also as policeman's elbow, march elbow, where the bursa get, this bursa, two bursas there, this bursa get inflamed. Okay, posterior surface subcutaneous, only having bursa. Superior surface capsule, bursa, and the posteriorly insertion of the tricep. Anterior surface having a medial and a lateral aspect, medial, intermediate, and lateral aspect. It come in the contact of the trochlea. Is coming the contact of the trochlea. The upper part is also accepted into the olecranon fossa. Okay. Now coming toward, we talk about the superior, anterior, and posterior aspect. Coming toward the lateral aspect, which is toward the ulnar notch. Okay, lateral aspect, which is toward the ulnar notch. The lateral aspect of the ulna, this lateral aspect of the ulna, along partially the posterior aspect, is also accepting the attachment of a extensor muscle that is known as anconeus. This is having attachment of anconeus muscle. Here is the attachment of the anconeus muscle. There is the attachment of the anconeus muscle or swiping fibers of anconeus muscle. This is the lateral aspect. So anterior articulating, superior capsular ligament, bursa and the tricep. The lateral surface of the olecranon process, anconeus. Okay, the medial surface. Look at this medial surface, because medial surface is common for that. In a linear way, on the medial surface, there is tendon of flexor carpi ulnaris, head of the flexor carpi ulnaris, and a projected fibers of flexor digitorum profundus is attached. Flexor digitorum profundus, and both are encroaching up to the medial surface of olecranon process. It's also in the medial surface of this coronoid process, and this is also attached in the air. It's projected, covering the whole anterior medial surface and projecting onto his flexor carpi ulnaris, the ulnar head, and the flexor digitorum profundus on the medial surface of olecranon process as well as the coronoid process. On the lateral side, anconeus. Above, capsular ligament, bursa, and tricep, anteriorly articulating and posteriorly subcutaneous. This is olecranon process of the ulna. Now coming toward this shelf. As you know, the superior surface is articulating surface, continue to form the trochlear notch. Anterior surface. Look at this anterior surface. Ulnar tuberosity is there. Anterior surface is having a rough triangular area, and this rough triangular area, look at this rough triangular area, having insertion of the muscle which is arises from the anterior medial and anterior lateral aspect of the humerus, forming the floor of the cubital fossa, working as a flexor of the elbow joint brachialis, the brachialis. Okay, But the ulnar tuberosity having attachment of a ligament which is laterally directed and attached on the radial tuberosity also, and this is having attachment of oblique cord. This is having attachment of the oblique cord. Okay, the triangular zone of anterior surface of coronoid process, the brachialis. Okay, and ulnar tuberosity with the radial tuberosity connected with the oblique cord. So this is the anterior surface. We talk about the medial surface, both olecranon process as well as the coronoid process. Medial surface having attachment of flexor carpi ulnaris, head is originating in a linear way, and flexor digitorum profundus, correct? Okay, anterior surface the brachialis and oblique cord. Now coming toward the lateral aspect, look at this one. The annular ligament attached on the margin of this ulnar notch. On this supinator crest, there are origin of a muscle that is known as supinator. Different bands, the oblique band and the trans band is attached on the different margin of this, the lateral aspect of this one, this trochlear notch. Okay, among the margin of the trochlear notch. Okay, now this is anterior, lateral and the medial part. Anterior, lateral and medial part, superior surface articulating. Now coming toward the different surfaces. Okay, here is the interosseous border. This is the interosseous border. Between the anterior border and interosseous border, large surface, and between the anterior border and the posterior border, there is the medial surface. I want to sum up in a one sentence. 3/4 upper part of anterior and medial surface both, plus encroachment up to the medial surface of olecranon process as well as the coronoid process. Very, very large muscle is emerging whose name is flexor digitorum profundus. Anybody asking a question? The deep muscle of the flexor compartment of the forearm, whether arising from the radius, flexor pollicis longus, or attached with both. One is arising from the anterior oblique line of this ulna and attached on the anterior surface of the radius, attached with both. Pronator quadratus, or arising from the ulna, especially the anterior and medial surface upper 3/4, that is known as flexor digitorum profundus, except the lower part where the oblique line give rise to the pronator quadratus, which is attached with the radius bone in two slips. One deeper slip in the triangular area and the superficial slip in the anterior surface. So anterior medial 3/4 surface, whether it's anterior surface between the interosseous border and the anterior border, or between the anterior border and the posterior border, the medial surface, 3/4 part giving rise to the large muscle, deeper muscle, which is known as flexor digitorum profundus, lower oblique line giving rise to pronator quadratus, which is attached on the radial bone. Okay, like this, arising from this area and attached on this part, radial part. Okay, deep muscles, deep muscle. When we talk about the posterior surface, this is the posterior border which is going up to styloid process. This is divided by a longitudinal line, and the muscle attached on the posterior aspect is in the upper part, the anconeus, fiber of the anconeus, which is laterally arranged, also blending with this one. Number one anconeus, which was continuing with the lateral aspect. Then after that, the abductor pollicis longus, extensor pollicis longus, and extensor indicis is attached on the posterior surface. There is not anterior boundary of the nerve box. Extensor pollicis brevis is not attached. Here is attachment on the posterior surface. Between the interosseous border and the posterior border, there is a posterior surface. An attachment on the posterior surface is of abductor pollicis longus, which was also arising from the posterior surface of the radius, interosseous membrane, as well as this part also. Then by a longitudinal ridge, there is extensor pollicis longus and extensor indicis is there. Extensor indicis is arising. And lastly, I told you the tendon of extensor carpi ulnaris passes through a groove between the styloid process and the head of the ulna on a posterior aspect. These all are very, very important attachment. Once again we are revising the superior surface, capsular margin, bursa and tricep, the posterior subcutaneous triangular zone, olecranon process, whether olecranon process of ulna medial part or coronoid process medial part or the itself medial surface. Flexor digitorum profundus is encroaching on this one and one giving rise to the linear head of the flexor carpi ulnaris. Okay, anti-3 surface. On a lateral aspect of this olecranon process as well as the posterior surface, upper part of this ulna and conius is attached. Okay, when we talk about the coronoid process, same medial side flexor carpi ulnaris, profundus, anterior surface, the blue area, shaded area, insertion, anterior surface, triangular rough area, insertion of brachialis. Below there is ulnar tuberosity to radial tuberosity, oblique cord. Now laterally there is an ulnar notch at the margin of ulnar notch in such a way, annular ligament attached below triangular zone, supinator crest, and origin of the supinator is there. Different band, oblique band as well as the transverse band is attached on this margin. Okay. Now between the interosseous border, look at this interosseous border and the anterior border, this is anterior surface, between the anterior border and the posterior surface, this is the medial surface, anterior medial upper 3/4 surface give rise to the flexor digitorum profundus and whose margin is also encroaching on the medial surface of coronoid process as well as the medial surface of the olecranon process. Flexor digitorum profundus, the lower part which is obliquely placed, give rise to the pronator chordatus, which is divided into two slips. The deeper slip is attached in the triangular part, lower triangular part of the radius, and superficial slip attached on the anterior surface of the radius. So pronator chordatus. Okay, this is anterior medial is over. Now coming toward the posterior aspect, we can see there and conius which is attached on the lateral margin of the olecranon process, reaching up to the upper part of the posterior surface of ulna also. Rest of the posterior surface having attachment of three muscles about to downward: abductor pollicis longus, extensor pollicis longus, and extensor indicis. I want to remind you, the anterior boundary of snuff box is formed by the abductor pollicis longus, extensor pollicis brevis. This is not longus. Extensor pollicis brevis is not attached here. It is from the posterior aspect of the radius. Okay, and the tendon of extensor carpi ulnaris is passing between the groove of a styloid process and the head of radius. This was a very concise description about the attachment of the ulna. I hope you can read from the book and the coordinate with these attachment with the book. Thanks for the patientful hearing. Thank you, friends.